Welcome back, guys. It's Dr. Somji.
And it's Dr. Solomon here.
Today we're going to be talking about how hair transplants work and whether they actually work as well.
Indeed, yeah.
So we're going to tell you a whistle-stop tour of how it happens with some videos as well, so stay tuned.
So we are living, breathing proof of hair transplants working. We're going to talk about exactly how they work and why they work as well.
Absolutely. So essentially, hair transplant is really simple. You take hair from one area of the body, so most notably your donor area, so the back of the head and also the sides. These are hairs where you've got too much hair within the area, almost 5 times the amount of hair than you actually need around the back and sides. And also they're not susceptible to future hair loss. So they're great supply and really healthier as well. And if you notice, your back and sides tend to be quite thick. If you've got thick back and sides, then you're a good candidate for hair transplant surgery. It's all performed under local anesthetic. So patient comes in, we are able to either trim the hair, or in our hair transplant clinic, we're one of the leaders in what we call long hair surgery, so you don't need to shave. The area is prepped, and then one bit that you specialize in is a lot of the anesthetic as well, right? So you've got a lot of protocols for making sure it's not as painful. So we inject local anesthetic within the area, and once it's anesthetized, then we perform excision of the grafts.
Yeah. So what's important to clarify and to understand is actually when we get asked about transplant, there's often the assumption that the transplant's coming from someone else or from perhaps an artificial hair.
Yeah.
In fact, the transplant is from your own hair, it's from your own scalp.
It's an autograft, and people say, well, if you don't have enough hair yourself, can I get it from my brother? Can I get it from my dad or whatever? And unfortunately, you can't, because it's still a transplant, it's tissue types, it's very unlikely to take, and it's not good medical practice.
Okay.
So how do you perform excision?
So an excision of a hair transplant, you are excising it by punch excising the skin. So we drill into the skin. We can do it manually, but we now use robotic methods. And we take each follicle on its own, depending on where we take it from, in the back of the scalp or the occiput of the scalp. That is considered to be the donor area, and it's a donor area because it's a different genetic code from the rest of the hair. So it's hair that we consider to be longer lasting and that will not fall out, and you're unlikely to lose that hair.
So this is all done on local anesthetic. Each individual follicle is taken out. If you're using follicular unit excision technique, you can take it out like that. Also, we can sometimes take a strip of skin out from the back of the scalp, especially for females that maybe don't want to shave their hair, and for larger procedures, we cut those underneath a microscope, so exactly like that. So each of them are individually dissected. Then you have all these individual follicles that are put in a storage solution. Then we think about how to put those hairs back in. So we create small incisions the same size as those little follicles in the areas where we want a hair, and that's the depth as well as the diameter is then essentially determined by us as surgeons. We do those small incisions to the amount of grafts that we've removed, and then those hairs, those follicles, are then slotted into that area. And then essentially you need to look after those grafts, follow to the aftercare, and from 6 months you start seeing really good growth of those hairs.
Yeah, so recapping what you've just said, essentially we are punch excising a hair, we punch a hole or drill a hole into the skin at the back and the scalp, we take out the hair, we then make a hole in the area that's going to receive the hair, and then we plant the hair in, and then we leave it for up to a year and assess the growth.
Absolutely, and it's magical. They really do work. I mean, 99.9% of transplants that we've performed at our clinic have worked. The only time when it may not work is if there's an undiagnosed autoimmune disorder affecting the scalp. Certain other things, like we talked about, infections can affect the growth of the hairs, but it's actually a very, very successful surgery, and it's performed worldwide by numerous surgeons. It's a constantly advancing surgery. We've experimented with a lot of robotic methods as well that helps improve our efficiency, because you have to transplant thousands of follicles to get a good result, and everything that we discuss we do thousands of times.
Indeed, yeah.
So to make that reproducible, sometimes we do need to incorporate more of the newest technologies to make sure that the hair transplants are perfect. Thank you so much for being interested in hair transplants. If you are particularly interested a little bit further, we do have a hair transplant series, so don't forget to subscribe to the channel, and then you can look on our video playlist. If you have any specific questions about hair transplants, just let us know. We're always showing little clips of our videos on our social media profiles, such as Dr. Medispa and Dr. Somji Skin, also on Dr. Tino Solomon as well on Instagram, so you can really log on to those two as well.